In today's Your Healthy Family, we're talking about ketamine, a powerful drug used primarily by anesthesiologists, but is showing a lot of promise when used in certain cases to treat depression and PTSD.
Studies at the National Institute of Health established that very low-dose ketamine, 1/20th the amount that you would use to put people to sleep, can bring people out of depression in as little as 4 to 6 hours. Further studies at Yale University revealed that if you give 6 treatments of this low-dose ketamine infusion over 2 weeks' time, most patients will have their symptoms stay gone for between 3 to 20 months. This is extraordinary.
As extraordinary as the results are, ketamine isn't a miracle cure-all for all depression or mental illness.
Ketamine treatment is definitely not first line, and we reject people who are coming in wanting to experiment or who are just casual in their thoughts about, well, maybe I've got a quick fix. The techniques that we use here are really focused primarily on the treatment-resistant depression group or the treatment-resistant bipolar or OCD or PTSD group.
Ketamine is not yet approved by the FDA. It's used off-label, and it's not covered by insurance. It also can have some side effects during the infusion.
Some people get a little bit sad. Some people get a little bit irritable. But that's just during the time that this very short-acting medication is in their system. In fact, I had one man who was deeply depressed, and every single ketamine infusion, he got more tearful. And after 2 or 3, he said, "Doc, I probably ought to stop this because all it's doing is making me sad." But when I asked him, well, wait a minute, how are you doing later that afternoon and the next day? He said, well, actually, I'm doing better. I said, that's what we need to pay attention to. It's not what happens during the infusion. It's what the infusion changes in your brain wiring.
If you have questions about ketamine, follow up with your provider. For Your Healthy Family, I'm Ira Cronin. For more health stories, at yourhealthyfamily.com.